You are a naturopathic doctor. What exactly is that, and how does one become a naturopathic doctor like you that becomes an award winner? Because you're doing some pretty extraordinary stuff.
Thank you. Well, becoming a naturopathic doctor for me was something that it was. My family has been involved in medicine for years and generations, I would say, I guess, as well.
But they were in the allopathic stream.
Yeah. Yeah.
And so did they go, excuse me, you want to do what?
No, I think they were glad that I sort of found something that I was drawn to and I wanted to do. So that was a good thing. But there's been a lot of discussion and about naturopathic medicine since, and I think I think they have a good understanding of it now, which is nice and good. Yeah.
And so you graduate from university, then you go graduate into medical school. Do you, or where do you get this training?
So I graduated with an undergrad in chemistry, and then actually came out to BC and sort of discovered naturopathic medicine through my partner at the time, who later became my wife. And she spoke about how the benefits of naturopathic medicine just had a huge impact for her health. And so then I went to the school. I looked at their curriculum. I thought, this is really interesting. I was actually really drawn to the acupuncture program. I thought that was extremely interesting and very scientific as well. And so I liked that. And I spoke to some of the students, and they were thrilled about the program. So then I applied. Yeah.
So, and this was probably before the work of Helene Langevin and her understanding of the relationship between acupuncture and fascia.
Yeah. I remember her talk, and I thought that was really interesting. There's been so many discoveries about how this can have an effect.
So, where did you go to school to study naturopathic medicine then?
So I went to the Canadian College of Naturopathic Medicine in Toronto, and it's a 4-year full-time program. It's post-grad, and essentially the first 2 years I would describe as being sort of very science and biology-based, understanding the mechanism of the body, physiology, anatomy.
Much the same way that a physician would start their training as well.
Very similar in terms of the starting and the grounding about how we function as organisms, and so we learn the Western approach to medicine, if you will, from that perspective. And I think there's such a great solid understanding of physiology through the study that's happened over obviously decades or whatever. But so that's part of the curriculum, and then it diverges, I would say, from the medical curriculum, where it's more about the approach to care for the patients. And there's a lot of focus on nutrition. There's a lot of focus on herbal medicine. There's a focus on physical medicine. There's an attention to these, I would say, it's non-prescription drug approaches to care, and more geared at sort of mobilizing the body's own internal support systems for health.
And so at the time that you're going through your studies, this is before there have been these great advances in our understanding about the microbiome. So how much does that lend credibility to and further evidence to everything that you've been doing?
Well, it's interesting. I remember probiotics were like a fundamental part of our learning, early on, and how there was a recognition of the gut health and just what we ingest and our interaction with the environment through this very, very deep connection through our food. And how that affects our gut health and our microbes and all that, and the use of probiotics. And then fast forward a little bit, and the microbiome becomes this huge thing within, sort of conventionally recognized as so important for health. This is, I think, typical in some ways to much of naturopathic practice. These are therapies or ideas that have been part of our medicine for years and are now being recognized for the importance that they have in terms of overall health. So it's validating in that way. Yeah.
So one of the challenges with taking on this area of study is that when you graduate, especially when you did, there is going to be resistance from within the Western or more allopathic stream of healthcare delivery. How do you come to terms with that, or how do you deal with it when you get people who want to dismiss what you're doing as being less than valid?
Right. So I'm okay with it if it's based on a particular idea or a topic, a focus on, what the medicine is or what the condition is and how it might be treated, because then we can engage then I can engage with the person in an intelligent, hopefully, and just sort of interactive way about the idea. But if someone comes at it with just sort of this overall bias against natural medicine, then it's like they're coming at this with blinders, and that's a lot harder to accept. I think that's changing a lot. I think there's less of that, which is really encouraging. But that I find more difficult to deal with. But it's sort of galvanizing too. So.
And so a big part of your career is that you also embraced the role of being a researcher. Why was it important to you to do that? And how do you move beyond being a clinician to also becoming a researcher?
Right. So I've always thought, I've always been interested in research as part of any inquiry. And I think that, we need to back things up. And I believe in the scientific method and all that. So applying this to therapies that are not well understood, especially in their mechanism and their proven efficacy, if you will, is it deserves the research, because people are using these therapies. We're seeing it in clinic actually having a meaningful effect for them. But to convince the public health care system and to convince others who are skeptical, you need research and you need data to back it up. So it's been really I feel so fortunate to be able to combine both research and clinic in my career, and actually I really encourage more people in naturopathic medicine and complementary medicine overall to get involved in research. It's really rewarding, and you can just interact with a lot of people that are interested in the idea. They're not interested in the politics necessarily, and that's where research really is thrilling, maybe too strong a word, but is really, it's supportive. Yeah.
But you're also an entrepreneur. You have a clinic, you have a staff, you have all of these elements in your life. What does a day look like for you?
So lots of really good people. We've got a phenomenal team at the Ottawa Integrative Cancer Centre. They are the clinicians are just so well-intentioned, so ethical in their care. So it's a total joy to work with them. And they also have great initiative. They bring forward ideas. So they're very much like, it's not like a sort of, well, dictatorship, obviously not, but it's not like it's very collaborative, which is wonderful.
Sort of a flat organizational chart.
Yeah, in a way. And so that's good. And just brought on an amazing clinic manager from that standpoint too. So, but my day is sort of mostly it's clinic and research, and then I'll do a little bit of admin as well. But I'm enjoying the entrepreneur partnership of it. Actually, it's interesting. Yeah.
So, how much of your time is spent with patients?
I spend 3 days, 3 part days a week right now with patients.
And then the rest of your time is divided between research and the myriad of other things you have to do in running a business?
Well, a lot of time in research for sure, and a lot of time in engagement. So engagement and communication and meetings and things like that, trying to bring together people. I see myself as a sort of a helping to bring people and ideas together, and getting people to be excited about the ideas, and then it just sort of takes off. Okay,
so a component in your work is the ability to interact with others, engage them, and create networks.
Yeah, it is. It is, and I think even with patients, that's part of the work too. So, and that's such a rewarding part, because it really, it makes it live.
So if a young person's looking at this and they're going, I want to be like Dr. Dugald Seely, where would you suggest that? yeah, you don't want to work that hard, you say.
No.
Where do they get started?
Well, I'd say, look at, often a science-based background as an undergrad is a great starting point. Doesn't have to be, though. Many people come into the college with an arts degree. There's some prereqs to look at. I would say look at the college, Naturopathic College. CCNM is a phenomenal environment for learning, really excellent teachers and administration and the student body. And so it's got a great campus. This is like an ad, but no, it's really a good space. So I would spend some time there just to check it out, and then look at what needs to be done to mobilize 4 years of life to learn that. And I think as far as anyone who wants to get into healthcare, who wants to make a difference for themselves and for other people, it's an amazing career.
Yeah. Well, thank you for sharing that.